All right, let's now talk about routes of administration, drug pharmacodynamics, and pharmacokinetics. The route of drug administration is going to affect the rate in which the onset of action occurs, and it may affect the therapeutic response that results. The choice of the route of administration is crucial, of course, in determining the suitability of a drug. Drugs are usually a given for their local or systemic effect. Absorption is the process by which medications travel through the body tissues until they reach the bloodstream. A couple of different types of drugs are enteral and parenteral. Enteral drugs are administered along any portion of the gastrointestinal tract. They include oral, which is usually put as in PO. This usually means by mouth. They enter the bloodstream through the digestive system and take as long as an hour for that absorption to occur. PR means per rectum, and we don't have any AEMT medications that will be administered rectally. One of the exceptions that you could have, if it's allowed by local protocols, would be D50. That's as a last resort. Sometimes is done this way, but as long as we have the IO available to us, this won't be on us. All right, parenteral medications administered only through any other route other than the gastrointestinal tract, and they include intravenous injections, which means into the vein, for medications that need to enter the bloodstream immediately. And this is the fastest delivery, but of course it can't be used for all medications. You also have interosseous, which means into the bone. It reaches the bloodstream through the bone marrow and requires drilling a needle into that bone cortex. It's painful and often reserved for patients who are unresponsive as a result of cardiac arrest or extreme shock. Most commonly used probably for children who have less available or difficult to access IV sites. Subcutaneous, or SC, means beneath the skin, and it's an injection given into the tissue between the skin and the muscle. Because there is a lack of or less blood here than in the muscle, subcutaneous medications generally absorb more slowly and have longer lasting effects. Useful way to deliver the medications, however, that cannot be taken by mouth as long as they do not irritate or damage the tissue. Examples are daily insulin injections and some forms of epinephrine, which we will be using. May not be appropriate for patients that have decreased peripheral perfusion, however. IM, or intramuscular injection, means into the muscle. That's usually absorbed fairly quickly because the muscles are highly vascular. Some forms of medications are designed for slower, sustained release from the muscle, and many of those are going to have the prefix DEPO, or depot, meaning that they form a deposit in the muscle after being injected. Not all medications, however, can be administered by the IM route. There are possible problems, such as damage to the muscle tissue, or uneven or unreliable absorption, especially in people who are experiencing decreased peripheral perfusion, as in shock. We also have sublingual, which means under the tongue, and a good example of sublingual medication is nitroglycerin tablets. In sublingual medications, they're absorbed by the venous plexus under the tongue and enter the bloodstream through the oral mucous membranes within a few minutes. It's faster than the oral route, and it protects medications from chemicals in the digestive system, such as acids that can weaken or inactivate them. Buccal is similar to the sublingual route, which means the medication is placed between the cheek and gums where it's absorbed by the bloodstream. Something common that we would use buccally would be glucose gel. Transcutaneous, or transdermal, means through the skin. Some medications are absorbed transcutaneously, such as nicotine, or patches, or nitro patches, or fentanyl patches for pain. So on occasion, a medicine that comes in another form is administered transcutaneously to achieve a slower, longer lasting effect. Intranasal drugs are a relatively new format that we use for delivery of medication, and we use a device called a mucosal atomization device, or MAD, to administer these medications. Liquid medication is turned into a spray and administered into a nostril. Quick absorption due to the high blood flow in the head and face. So a good example is like when we use Narcan intranasally. And inhalation, aerosolized and drawn into the lungs to the mouth or nose as the patient breathes. So an example would be nebulized medications such as albuterol, or with a metered dose inhaler that the patient may have on themselves. Some medications are inhaled in the lungs so they can be absorbed into the blood more quickly, and others are inhaled because they work in the lungs specifically. Generally, inhalation helps minimize the effects of medication on other body tissues. And you can find these forms in aerosols, fine powders, and sprays. All right, pharmacokinetics. Pharmacokinetics is movement of drugs through the body, and the effectiveness of a drug as it relates to its pharmaceutical properties is called pharmacokinetics and pharmacodynamics. Pharmaceutical properties determine a drug's concentration at its site of action. And drugs modify the existing functions of organs and tissues. They do not give new functions to tissues or organs. In general, drugs cause multiple actions rather than one single effect. A drug action that's the result of a physiochemical interaction between the drug and the molecule in the body, such as a receptor. Once administered, drugs go through 4 stages. Pharmacokinetics is the study of these 4 stages and the metabolism and action of drugs. Drug absorption. Absorption is the passage of a substance through some surface of the body into the body fluids and tissues. There are numerous variables that affect drug absorption, including the nature of the absorbing surface. Some surfaces, of course, are highly permeable, and it's easier for a drug to travel through a single layer than multiple layers. The greater the surface area exposed to a substance, the greater the absorption. And also consider the blood flow to the site of administration, because blood flow to a particular area regulates how fast the medication is absorbed into the central circulation. What's the solubility of the drug? The more soluble the drug, the faster it enters the circulatory system. What's the pH of the drug? The pH of the body and the drug affects the rate of absorption. Some medications are coated to keep them from being absorbed before they reach the small intestine. What's the drug concentration? The more of a drug that's available for absorption, the more that will be absorbed and remain in the system. Often, a loading dose or bolus is given, followed by a continuous infusion to maintain a constant therapeutic level, such as with amiodarone or lidocaine. What's the dosage form? A liquid will be absorbed much more quickly than pills because, of course, pills must be dissolved before they are absorbed. What route of administration have we used? The IV administration is the most rapid route in the pre-hospital environment, but intramuscular and subcutaneous routes are slower because they depend on the blood flow to the area of administration, which may or may not be present in any degree. Bioavailability is the rate and extent to which an active drug enters the general circulation, permitting access to that site of action. It's determined by the measurement of the concentration of the drug in the body fluids or the magnitude of the pharmacologic response. Diffusion is movement of a solute from an area of higher concentration to an area of lower concentration. Osmosis is movement of a solvent or a fluid from an area of lower solute concentration to an area of higher solute concentration. And filtration is removal of particles from a solution by allowing the liquid portion to pass through a membrane or another partial barrier. In drug distribution, drugs pass freely and quickly out of the vascular space into the interstitial fluid. Blood flow to the area determines the amount of drug reaching a particular part of the body. In some areas of the body, such as the brain and placenta, are less accessible to certain drugs than others. Biotransformation. Many drugs are inactive when they're administered and only become active once they have been absorbed and converted into an active form in the blood or by the target tissue. Biotransformation is the chemical alteration that a substance undergoes in the body. The primary organ for biotransformation is the liver. If the liver is diseased, then inactivation or detoxification of the drugs may be impaired. Drug elimination. Excretion is the elimination of waste products from the body. Drugs are eliminated in their original forms or as metabolites. Some of the organs that deal with excretion include the kidneys via the urine, the intestines through the feces, the lungs via respirations, and sweat through the salivary glands or mammary glands through the breast milk. The rate of elimination varies with the amount of drug in the body and the underlying condition of the excretion organs. A patient's poor ability to eliminate the drug may lead to an accumulation of the drug if subsequent doses are given, resulting in toxic effects. Consider this especially for patients in shock and for geriatric patients. Pharmacodynamics is the way in which a medication produces the response that we intended, also known as the mechanism of action. A medication's pharmacodynamics also include factors that may alter the intended response and any other side effects or unexpected effects. That's its mechanism of action. To produce the optimal desired therapeutic effect, a drug must reach appropriate concentrations at its site of actions. Molecules of the chemical compound must proceed from the point of entry into the body to the tissues where they react. The magnitude of the response depends on the dose and the time it takes for the drug to travel in the body. Drugs may produce their effects locally, systemically, or both. Systemic effects. Systemic effects occur once the drug is absorbed by any route and distributed by the bloodstream. Almost always involve more than one organ, but the response of one or another organ may predominate. Medications cause their action on the body by the following. They may bind to a receptor site. They may change the physical property of cells. They may chemically combine with other chemicals. They may alter a normal metabolic pathway. Medications that bind to receptor sites are more prevalent, particularly in the pre-hospital setting. Cellular response can be wide-ranging, depending on the chemical mediator and the cells that are being stimulated. The mediation molecule must compete with the naturally occurring chemical mediator and potentially other medications. Once the medication finds its target tissue, it needs to accumulate to a sufficient concentration to produce its desired effect. The drug-response relationship correlates the amount of medication given and the response it causes. When administering a medication, you'll need to know the onset of action, which means how long it will take for the concentration of the medicine at the target tissue to reach the minimum effective level. The duration of action is how long the medication can be expected to remain above that minimum level to provide the intended action. And the termination of action, the amount of time after the concentration level falls below the minimum level to the time that it's eliminated from the body. Onset, duration, and termination of action affect the therapeutic index. The therapeutic index is the ratio of a drug's lethal dose for 50% of the population, or LD50, to its effective dose for 50% of the population, or ED50. It gives an indication of the medication's margin of safety. The wider the difference between the two numbers, the more safe the medication is supposed to be. Each medication also has a biologic half-life, which is the time it takes for the body to eliminate half of the drug. Therapeutic thresholds, or minimum effective concentrations, or minimal concentration required to produce the desired response. A concentration lower than the therapeutic threshold will not induce a clinical response. A concentration higher than the therapeutic threshold can be detrimental and possibly fatal. The goal of drug therapy is to give the minimum concentration of a drug that will produce the desired effects. Factors altering drug responses. Age. As the body ages, metabolism slows and the organs of excretion do not always function as well as those in younger patients. Likewise, infants and small children have an immature organ and systems and cannot metabolize the same amount of drug as an adult. Body mass. Many medications are given based on a patient's weight, so as that weight changes, so does the dose of the medication. Owing to different body compositions of fat, water, and hormones, certain medications affect males and females differently and must be adjusted accordingly. Environmental conditions and time of administration. Factors such as the time of the day, the temperature, the altitude, and noise may alter the body's response to a drug. Genetic factors. Patients who already have some compromise in function due to an existing condition may not be adversely affected by certain medications owing to changes in absorption, distribution, metabolism, and excretion. And then psychological factors. Mental stresses can have negative effects on the entire system. What are some factors that influence drug interactions? Well, there are many variables. It's important to be aware of the potential interactions of drugs that are prescribed and those that the patient may be administering to themselves. Many patients, especially elderly patients, may take several medications each day. It's called polypharmacy. The chance of developing an undesired drug interaction increases rapidly with the number of drugs that are used. Also the case when patients take medications that may interact with other substances such as food or alcohol. Warning labels indicate the substances that may cause these interactions. Predictable responses. Well, because of the extensive research that goes into developing and testing a medication, generally there is common knowledge about what a drug will do to a patient. Anticipate the responses beyond the desired effect. Side effects are any actions that a medication may have other than the desired actions. Side effects may occur when a medication is administered properly and under the appropriate circumstances. Iatrogenic responses, an adverse condition inadvertently induced in a patient by the treatment given. A urinary tract infection that develops in a patient after insertion of an indwelling catheter is one example. Iatrogenic drug response results when the administration of drugs leads to symptoms that mimic naturally occurring disease states. There also could be unpredictable responses. Some patients may have adverse effects that are not anticipated. The most common unpredictable response encountered in the pre-hospital setting is an allergic reaction. An allergy develops when a person has been previously exposed to a particular antigen and develops antibodies against that substance. It's called sensitization. After a person has been sensitized, subsequent exposure to the same substance results in hypersensitivity. Because the patient is hypersensitive, the drug activates the immune system. Allergic reactions are generally unpredictable unless they've happened in the past and the patient knows what to expect. And they may lead to anaphylaxis, which is an acute systemic reaction that is generally life-threatening. Allergic reactions can be immediate or delayed. So before administering a medication, if possible, question the patient about any known drug allergies and remain alert for allergic reaction after administering any drug. Serum sickness is a delayed reaction that's hypersensitivity similar to an allergy. It occurs a considerable amount of time after a stimulus. It can develop as late as 7 to 14 days after the first exposure to a medication. Idiosyncrasy. It's rare, and the patient may experience a completely unique response specific to that person and not seen in other patients. Idiosyncratic reactions are peculiar or individual reactions to a drug. Tolerance, built by patients who take particular medication for extended periods. These patients will have a decreased response to the same amount of medication, often requiring higher doses than normal. Cross-tolerance is a tolerance to other drugs in a certain class as a result of prolonged administration of another medication in the same class, also often seen in patients who take pain medications. Any medication needs to reach a minimum concentration in the target tissue before it becomes effective. That concentration is reached by providing a specific dose. If several doses are given in a relatively short time, the patient may experience a cumulative effect. Cumulative effect is the increased effect when a medication is given in several successive doses, which might result in therapeutic or non-therapeutic effects. Drug dependence occurs with prolonged administration of a medication. Psychological and sometimes physical state resulting from continued use of a substance. Patients can experience a compulsion to take a drug on a continuous or periodic basis to experience its effects or to avoid the discomfort of its absence. A person will have specific or significant symptoms if he or she stops using the medication. Habituation is a physical tolerance and psychological dependence on a drug or other drugs. Drug interactions. Many patients will take multiple medications at one time. Drug interactions when the effects of one medication alter the response of another medication, and they can be fatal. This interaction may not always be anticipated. It's possible to see the opposite or completely unrelated response. Drug antagonism. When a body is taking more than one medication could block the body's response to another medication. Summation effect. It's an additive effect where you have two drugs that have the same or similar effect that increase the patient's response when both are administered to the patient. Synergism. When the patient receives two drugs that have the same effect but that produce a response greater than the sum of their individual responses. In other words, two drugs that have an effect on a scale of 1 to 10 as a 2, you would expect them to have a 4 when put together. However, they have an 8 when put together. Potentiation is the interaction between two medications that cause one drug to enhance the other. Some potentiation effects are known and can be exploited to achieve a desired effect. In other cases, potentiation may occur unexpectedly. And interference, which is a direct biochemical interaction that takes place between the two drugs. All right, well, we're going to stop it right there, and we'll pick up with drug storage later.